Hi, everyone. Thanks for tuning into the Buzz Podcast presented by QRM Quality Rehab Management, where we are dedicated to pushing out daily quality educational content to your therapy teams, to your nursing home teams, to the healthcare professionals that are serving aging adults every day. Please share this information with them. We are trying to get it out as quickly as possible from reliable sources, but please subscribe because, as you all know, every day something changes. We learn something new, and what we're telling you to implement today might look completely different tomorrow. So stay tuned, stay up to date. We will try to get the most accurate information out to you as quickly as possible. I'm your host, Casey Lee, Quality Clinical Specialist with QRM and physical therapist first. And I received an email today's March 19th at about 2 o'clock today from my professional organization, the APTA, American Physical Therapy Association, with a document laying out some guidance for PTs, OTs, STs in long-term care and skilled nursing facilities. And so I've included the document in the show notes, but I want to go through it in detail because I think it's got some really great information that makes sense, that is applicable. We can use this to not only contain this thing and prevent the spread, but also as a script for our therapy care plans and our goals moving forward in this pandemic. So I'm going to go through it in detail. It's a document that's from the American Healthcare Association and the National Center for Assisted Living. The title of the document is The Role of Physical and Occupational Therapy and Speech Language Pathology Personnel in Long-Term Care Facilities during the COVID-19 pandemic. And the intention is to restrict the entry of as many people as possible, as each person entering increases the risk of spreading COVID-19. So the intention of this and the intention of all of the mandates, right? It's not to be mean. It unfortunately feels real mean, but the intention is to keep COVID-19 out of your buildings, because if it's out of your buildings, the risk of spreading is null and void. And then, oh goodness, if it does get in your building, then you also need to take the steps to keep it from spreading in your building. So first, step number one is keep it out. And then if it does get in, keep it from spreading around. That is the intention of this document. That is the intention of the mandates. It's why, and it's the intention of why we have to change the way we're practicing right now. We are essential. If you listened to the podcast yesterday, I emphasized this. Therapists, PTs, OTs, STs, PTAs, OTAs, we are essential. We are integrated into the essential needs of our patients. But the way we provide those services has to look different right now. It cannot look like it did 2 weeks ago. Has to look different. And I think that this document does a really great job of laying out how this is going to look. Like, we will absolutely provide our skills. We will continue to treat patients because we are a part of their essential needs and improving their function and educating them on infection control and prevention and risk of spread when they discharge from our communities and our facilities. Like, we are a part of the education, the functional improvement, the outcomes, the patient satisfaction, all of those things. But we also have to reduce the risk of COVID getting in and spreading around your buildings. Okay? So here's what we're going to do. They have laid out that we're going to need to make therapy-specific changes, and they might include the following. So they've listed 4 different things that we might have to do in light of the pandemic. Number 1 is review the care plan for every single patient, the goals, and discuss them with the resident to determine if their current plan needs to continue as is or be modified. Now, I will just go ahead and tell you, podcast listeners, we need to change our plans. Every single goal should be reviewed, and the determination needs to be made, is this an essential need, an essential goal, Or is this a goal that needs to be deferred to another time? Okay. We are focused on the essential needs. That is the focus right now. It has to be that way. So every single patient on your caseload, review every single goal and determine whether or not it is an essential goal or it is a deferred goal. Some of our plans will need to be modified. That is no question about it. We will need to modify and defer goals that are not essential, like dynamic sitting and standing balance, or fine motor coordination, or lower body strength 3+ out of 5. Like, those are the things that need to go. They're not essential. We need to be focused on getting up out of bed, right? We can't have people laying around in bed because, again, if you listened yesterday, the risks of being inactive are pretty bad too. So we can't have an institutionalized dependence program to prevent the spread of COVID-19, because now we're increasing heart disease, we're increasing the risk of pressure ulcers, we're increasing the risk of depression and anxiety, all sorts of other things that are consequences of not getting up out of bed, going to the bathroom, getting your showers. Like, we are integrated into the daily functional skills of our patients. That's where we need to focus. Those are your essential goals and interventions. We should evaluate if which of our services are essential to meet the needs of the residents' healthcare needs at this time and which should be deferred. And they have a note here that if COVID-19 does get in and begins to spread in your facility and staffing levels drop, therapy professionals in a long-term care facility should anticipate being asked to provide additional public health support activities within the center, and therapy services may need to be suspended in order to meet other residents' basic needs. So here's the thing with that. If we have modified our plans and our goals are all essential goals, this note doesn't apply. It might apply to non-therapy patients, and of course we're gonna help. We're gonna do whatever we need to do, right, to get through this. But for patients that are on therapy services, we have now reviewed every single plan and every single goal and made the determination of which goals are essential versus non-essential, and we have deferred the non-essential goals. So we will be providing skilled therapy because we are working on essential goals. So we're not going to, if we have 30 patients on our caseload and we're being asked, because there's a shortage of caregivers in our buildings because we've got a risk of spreading in our facility, and we're being asked to pass food trays because caregivers have to provide essential care needs to residents. Well, that is where we step in and we provide and assist and use our skills with the essential care needs for the patients that are on our caseload. Okay. And then we free up the caregivers who are available to pass the trays and perform those unskilled services. We take the skilled services. That's what we do. Keep the skill, keep the functional tasks, keep the essential needs under our umbrella to free up caregivers to complete the unskilled, non-skilled tasks. Okay, so when I read that, that's what I see. All right, item number 2 is pretty straightforward. Group and concurrent therapy should be discontinued if it's a part of the care plan. I mean, I am the biggest group therapy advocate. I love group therapy. When all of this is over, we will have a group therapy party in your building. I can't wait. But right now, it's just not safe. So we're not going to do it. We've made a lot of progress with it, but we just can't right now. So no more group and concurrent therapy, period. Number 3, consider delivering care in individual resident rooms rather than in gyms. And individualized one-on-one care should be provided in a manner to maintain social distancing as practicable. Absolutely. The gyms, there's just so many people in and out. No, like if we can avoid it, let's avoid it. more in-room treatments, recognizing that there's a risk of social isolation. This is the time to get creative, use your technology, call family members, FaceTime with family members and friends, and, try to encourage and support safe socialization at a distance when possible. But the gyms are not going to be the primary place where we treat these essential goals, essential needs, which really makes sense because it's not going to be time to get on the new step. The new step and the omnicycle, all of those things, those are not appropriate right now. They're just not. They're tools that are not in our toolbox right now. We have to get integrated into the day and the life of our patients, which has nothing, still don't really understand why the omnicycle is so great. Are these patients going to be bike riding in the future? Maybe, I don't know. If they are, then great. I ride a bike, so maybe that could be a functional task for me. But for many of our patients, getting on the bicycle and riding is not functional. It's not applicable. It does not apply to them. And right now, it is not essential. Defer that goal, that intervention. And it's one less thing that you gotta disinfect after each and every patient use, right? The more things that your patients are touching in the gym, the more they have to be disinfected and sanitized. So keep them out of the gym and in their rooms when possible. And then number 4, extra care should be taken following CDC's guidance when cleaning therapy equipment between use. And we have guidance on this, and I'll be including that and actually dedicating a podcast to it because I think it's just really important that we know what they're saying and what they're recommending, what types of cleaners are effective versus not effective. There's a ton of resources available on this right now, and I'm getting questions about it. So that tells me that it would be worth a 15-minute podcast to go over what cleaners work, which ones don't, how far away do you need to be to spray it, what parts need to be sanitized. I think that's just good for a dedicated podcast. So stay tuned on that. So those are the 4 items. Number 1, review the plan, review the goals, and modify to ensure that the plan is only essential goals and needs that are being addressed, okay? And that is every single patient that's on your caseload right now. Ask the question, is this essential? If not, defer it to another time. Number 2, no more group and concurrent therapy. Simple. Number 3, treat the patients in their rooms. If they need to come down to the gym for something specific, that's okay. Just recognize that you're going to need to wipe it down, clean it down, keep the patient safe. But if you have a patient going home, they have steps to get into their home, you need to practice stairs, just make that plan. Talk with your team. Wipe down the steps, wipe down the railings before and after that patient, and bring them down for that one intervention, practice it, and then get them back to their room. Number 4, follow the guidance on cleaning therapy equipment. So use the proper cleaners and the CDC's guidance on cleaning and sanitizing your therapy equipment. And again, I'll have a dedicated podcast for that for you to share with your teams. So this document has a couple other bullets that I'll go over really quickly. Non-essential personnel, especially non-direct care staff, should continue their work if as feasible from a remote location. I think we all know that all buildings and clients have been adopting this practice. If people don't need to be in the building, they're not in the building, which is great. There may be situations where therapy clinicians furnish care in more than one long-term care facility during a single day. We want to try to limit that. So that is something that we are trying diligently to reduce the amount of moving around of our therapists. To, again, just the whole intention is to keep it out and keep it from spreading. If we can keep it out of your building, again, null and void. It won't spread if it's not there. So keeping it out by keeping therapists at one site is ideal. And one of the many reasons why we're really trying to limit PRN use, unless it's absolutely, unless it's essential. When it's essential, we will absolutely support that. But we're going to question and try to find alternatives for sure. And the final item on this document is that we understand how difficult this may be. However, the threat of coronavirus to older adults and those with underlying health conditions has shown to have dire consequences, and we must do everything we can to prevent the further spread into our buildings. So I think we all know that. We're here to help and prevent and do our part. And this just provides, I think, some very realistic, usable guidance on how therapists can assist with the risk of COVID-19 coming into your buildings and spreading if it does get in. I hope that if you have questions, please reach out. My email is clee@qrmhealth.com, and I will talk to everyone tomorrow. Thank you so much. Take care.